Okay, good morning, folks. Thank you very much for attending and best wishes for a happy and healthy new year. We look forward to a positive one and some useful movement in social care. There's lots to cover. And before we actually get into the meeting, I'll just say that we've got a couple of people joining us today. We've got Skills for Care and John Buttle is here already, who will talk about um, LDSS training funding. We've got, between Dudley and myself, we've got quite a number of items to cover. Um, and we can't cover them all in detail, but we will give you some overviews. There's one or two free items as well. And then we'll cover them in a bit more detail or put links on the website so that you can pick them up at your leisure in that sense. Dudley.
Good morning, everyone, and Happy New Year. I know it's a bit late in the year, but if I haven't spoken to you or seen you in person or over the phone, Happy New Year in advance. Yes, there's a lot that happened last year, and now we're going into 2026, and as you can see, it's not stopping. The social care sector in itself has, there's going to be various changes, developments, but the biggest issues and concerns are for business owners and the sustainability of the business, and really trying. We know the margins are very tight. We also know that the regulator as well is not making it easier. Um, Today's meeting is just to set the tone for the rest of the year. We're going to have different speakers and different things throughout the year. Also, some news as well that we will be sharing right now as we'll be delivering some different projects. You've known us to deliver things like international recruitment and things around international recruitment. And we've worked in doing some delivery around elements with Skills for Care as well. But we are now going to be the main partner as a care association for the whole of South London in dealing with delivering better security, better care regarding DSPT. And you'll be working with us, or be your partner to work with in South London, in North London. You'll be working with the care provider's voice. So we'll be sharing you a bit later today of what's needed from you, ready to keep you up to date. So that's one of the things, one of the pieces of news. The other news that I came across the other day is regarding HMRC, especially for dom care providers. We've always had issues regarding regulators and so forth. So we dealt with CQC. We also had the HMRC, the Home Office and UKVI, but also as well, HMRC are looking into businesses. And yes, you have accountants, that's all well and good, but there will be a concern now about the hours and the way that your hours are represented in regards to whether when you're paying your staff, whether you're paying, especially dom care, whether you're paying for them and their travel time, waiting time, and is that taken into consideration when you're making payments? The HMRC are going to be coming down on providers. And in North London, North East London, letters were sent through the doors of care providers just to check to make sure they were up to speed. So we really don't want you going through any of that. So there's going to be a lot to unpick this year, but really be on top of your game is most important. Um, Doing things on the cheap isn't probably the way forward. So really getting your policies in place, good practice, even if it's spending a little extra pennies to make sure you're safe and compliant, is probably the way to go for this year. The likes of Lcas are here for advice. We advise you as well to be very wary. We know now with the age of and the dawn of AI that people now probably think they can put into some form of generative AI sort of system and software, and it'll give them the answer. Be very careful, because obviously the regulators now as well is also coming down on providers who are just using AI fully and not be able to describe or tell what they're doing. I'm not saying don't use AI. It's a wonderful tool in itself, but also be very mindful when you're using it, go through it. I've dealt various projects with AI, and the AI project was telling me various things that didn't add up from figures and all sorts of things. So be very careful, justify what you're doing by just going for everything. You don't, I mean, it doesn't cost a thing just to go over everything, but yes, use all the tools available, all individuals as well. So these would be some of the things I would be sharing as my 2026 sort of message for you at the beginning. Um, Keep in touch, and this is covering from your workforce, everything. It's going to be probably a long year. But if you do things as best as you can, hopefully we should all get through this together. So that'll be my beginning message. Peter, I'll pass it back on through to you.
Okay, thanks, Dudley. There's a lot there, and there is a lot in this meeting to digest. Dudley mentioned CQC. I've put a link in chat, which is the Rebuilding CQC Progress During 2025. That's You can obviously read that at some point, and that will give you some hints of what's coming in 2026. They are doing more inspections. The inspections are covering more points. And we have lined up a further meeting around how to avoid getting RI at inspection and what to do if you think RI is heading your way. So we've got a bunch of experts putting that together for a forthcoming meeting. And we have a date for a February meeting. We have asked CQC, one of the senior people at CQC, if they will attend. We've had a couple of meetings about it, but we've not had it confirmed as yet. So we will let you know. There will certainly be a meeting in February, and we'll add the details of that meeting, the invitation details later today. I've also had quite a lot of comments about tendering. This is partly been primed by the fact that K&C have got a tender out. What you will find with local authority tendering is that they're making it more difficult for smaller providers to access them with steps like greater turnover, etc. Now, from the various events that Dudley and I attend, we're finding that they're wanting the small providers to group together to collaborate to put tender bids in so that they've got a turnover that passes a certain level. They're also looking for smaller organisations, whether they're in social care or catering or hospitality or selling shoes, whatever it is, to group together to better cope with the requirements of things like the Employment Rights Bill. So do look to some of your colleagues, even your competitors, to work with them. If you are looking at tendering and you want some advice, then we would suggest that you talk to Obi. And I'm just putting her details in the chat, if I can find chat. And she will be able to help you through the process. And she also has a very good website that will give you a lot of information. So by all means, do contact her. I'm just going to, excuse me, go through some slides quickly. These are parts of information. And let me just go up to the top of those. Right. Okay. Presumably you can see those, Dudley? Okay, great. Thanks. Some of you will already have seen this. It has been circulated. Lcas is part of the Care Association Alliance, and that links into the Care Providers Alliance. And between us, we meet with the government regularly. You will have seen or heard about the provisional local government finance settlement. There's a lot of talk in the press and the media about extra money for social care, but in fact, it's not available until 28, 29. So we could all well go bankrupt by then. There are links. You will get this, you'll get a recording of the meeting, you'll get the slides. So please do look at it. The government, in their wisdom, they're looking for feedback from providers. So, and I know there's lots of surveys kicking around, but please pick out the important ones and respond to them. And if you've got a problem, talk to your MP, talk to your councillors. If you need support with that, need template letters, again, let us know. Part of this year, or partly coming in this year, is the Employment Rights Act. The first changes start next month. And the first thing will be giving workers access to sick pay and paternity leave from the first day. So it also introduces new protections for pregnant women and new mothers. You'll probably be aware from the hoo-ha that Labour has dropped plans to give all workers the right to claim unfair dismissal from the first day of the job. That will come in after 6 months in employment. Now, at the moment, if you've got an unfair dismissal case, it's taking 3 years to get to court, and that's going to cost you a lot of money. The lawyers, having been at Portcullis House earlier this week, listening to lawyers, they're expecting a lot more claims, and they're expecting it to take even longer to come to court. And no doubt, as there's a shortage, there will be an increase in fees. I would advise that people sign up to something like Citation or an alternative, because they can help you through the process from day one. And you will need to alter your policies and procedures and make sure that these are communicated to your staff and be able to demonstrate that your staff understand that. Because when CQC or local authority inspectors come in, these will be very easy for them to check. So please don't get caught out. Sick pay rules will change in April 26. 0 hours is yet to be decided. It's a big area. There's lots of differences of opinion, but you're probably going to find that people have a right to guaranteed hours, to reasonable shift notice. That doesn't mean you're doing this tomorrow, or can you do this afternoon? And they will expect to be compensated for short notice cancellations. Trade union activity, that will come in February 26. We'd hoped that Unison would give us more information, which we're still waiting for. There are some very reliable and some very unreliable information sources with regards to the Employment Rights Act. If you use Citation or an equivalent, use them. ACAS is a first-class source of information. And also ACAS will give you advice free over the phone, and they run a lot of free courses. They also charge for courses, but they run some very good free ones. Something else that you're going to get asked about by CQC, stress in the workforce. Here's an alternative for you to get some free accredited training. This is IOSH training. They've got 5,000 free places available. Okay, some minor terms and conditions, but you follow it through. It's first come, first served. You can do it online. You can do it at regional centres. There's lots of flexibility. It's a really useful free course. So you'll get the information, or if you want it later in today's event, we can simply put that link in the chat. Department of Health and Social Care Fair Pay Agreement, they're looking for people to contribute. You've only got a couple of days left because the consultations close on the 16th. So there are various sets of links. The consultation itself will remain open, and they are trying to get people engaged. And I think the view is if you don't contribute, you're going to get what they give you rather than what you might want. Another survey, but it's a useful survey. Again, we'll circulate this. It's done the rounds, and you've only got a couple of days to fill it in. But we need people in social care to actually contribute. And it is true to say that your feedback does drive some change. So please, please contribute to that one. This is another area that there's been lots of talk about, CPR guidance for adults. In a way, it is more apparently related to learning disabilities, but is a free option to get some training or to go to the meeting and sign up for that one. There's also another piece of free training or free information available that we've circulated, but we will recirculate that when we send the notes of the meeting out. Okay. And just a few of the bits that people have asked us about. Everybody complains about insurance, the cost of insurance, including me. But if you're struggling with your renewals or you're looking for insurance, then give Michael Jobson a call or send him an email. He is very helpful and they are very competitive experts in social care insurance. Another interesting area that we've been contacted about is waste, removing waste. It's more relevant, I guess, to residential homes or supported living than it is to dom care, although questions have been asked about waste from dom care. As a provider in dom care, you may be asked how you manage this through by your local authority. It's not really your problem, but if you've got issues, particularly as a home, then Anenta will be able to help you out. Give them a call, send Matthew an email. Back to what I said earlier, you need to be on the ball with all the changes. Citation will help you out. AI, as Dudley said, won't sort it out for you. And HMR visits, again, has come up. If they decide to go to town on you, you need to get advice very, very quickly. HMRC are not great people to actually deal with. And that's the slides from me. So over to you, Dudley.
And very quickly, Peter, I think people have been asking for some of the links that you could kindly share for some of the things that you've mentioned there.
Okay.
Just on a quick point before we open up for any sort of quick questions regards to that, because there may be one or two points that people want to raise. What Lcas, we are, as Peter mentioned, part of a national group called the Care Association Alliance. So we grab information that happens. We're in meetings with the Department of Health and Social Care and larger bodies, like the Skills for Care and other CQC, where Peter goes and meets with them regularly, believe it or not. So he does share some of the information that does come here and presents it to them. One of the things we're finding is that there is so much things that are happening, things are getting missed. So on top of everything, we try our best to share that information via email and also via WhatsApp group, which Peter will share as well. So if you're not part of the WhatsApp group, please do let us know and we will try our best to keep you on there, because those are sort of things that probably will keep you in the loop, because you blink and before you know it, we're in March and there's a whole another raft of information that's been missed. As much as Pete and I are very happy to help everyone, it would be helpful if, for example, if some of the links or some of the things you can do and we can advise you to put things in place, I think is hugely important. So that'll be my advice going forward. And before we go into the next segment, would anyone like to ask any questions regards what Peter's actually just showcased, or maybe an experience they may have had or advice that they may want to share, or experience they want to share with the group? So anything around training, around, as we said, stress training, we know this, we know about other things. Yeah, we can do. That'll be fine. We'll put you on there. In regards to the WhatsApp group, please can you just put down what area you're based in? So, for example, what borough and the type of service and your name. So it makes it a lot easier to put you into the different groups that we've got as well, which is very helpful. Um, I know that there's going to be a lot more information coming out monthly, and as as we know, as we've said before, we hold monthly meetings and we have different topics throughout the year. So, for any topics you'd like us to cover, we will cover that. That's not an issue. And we also have access to various experts as well. So if there's anything that Peter and myself can't answer, we will refer you to a various group who will be able to help you further along. So I think that's hugely important as well. So to bear that in mind. So I'm not sure if anyone else wants to sort of like share or ask any questions before we move on to the next section. Peter, I'm not sure if you're happy with that or move on.
The only other thing, excuse me, I would mention is that time-honored classic of people getting paid by local authorities or the NHS. If your payments have slipped or you're struggling, please let us know. There have been some updates to the rules and regulations, and I'm trying to get a bottom line on it so that we can share that. But I'm aware that there have been some very short-term changes in terms and conditions of payment without consultation. And again, people telling me that they're struggling to actually get paid within the time frame. So do let us know. We're not going to share it. It's confidential. But we do need the information from you so that we can actually try and get the answers. Thanks, Dudley.
No problem. I'm going to hopefully now go into my bit now. Hopefully, let me see if I can do this. That's better than that. Okay, let's see. Gonna see if I can do my screen. So can everyone see my screen?
Yep.
Okay. Well, as I mentioned earlier, Lcas are going to be the organization or association that is going to be helping um, providers in South London with DSPT, better security, better care. And I'm just going to run through the reasonings why we're playing a part in it and the sort of things to look forward to over the next 3.5 years, which we will be doing. So get used to us knocking on your door and being in touch. But I think I'm just going to go through why the importance of the SPT, if I'm sure some of you may know of it already, but just a reminder of the importance of it. So people say, why DSPT? What's the Data Security and Protection Toolkit? Well, it's an online self-assessment of your organization's data security. It demonstrates compliance with data protection and legislation. It's something that's reviewed annually. It gives advice and it's a checklist for good practice. Um, Before a lot of many years ago, or just before COVID, many people didn't really think overly about their sort of data security, especially online. But since COVID and after COVID, most people are using some form of digital system, software, it integrates with their care and level of care. And as a result of that, it's open to people to compromise that. So it's hugely important to make sure that people are really up to date. And there is a reason for this, and part and parcel of this is what we're trying to do to help educate, but support those and doing what they're doing. So why do providers need to pay attention to this? First and foremost, data, and as I mentioned, cybersecurity is important for safe sharing of your records. We know so much records are being shared now, especially increased use of digital technology during from the pandemic, as I mentioned before. It's really showcasing, as I said, on the basic level, any information that's shared is really meant to be vital, and we don't want your records going anywhere, because if that was the same thing to happen to any of you as individuals with your GP or in hospital, you'd be upset. And it's also about yourselves as your responsibility to keep people's confidential information safe, because we expect you, or we're expected as providers, to make sure we keep people's records safe as well. And the other side of it, now we know, is to protect your business from risk of being fined for data breach from the disruption of a cyber attack. Over the last year, we heard even large organizations like Marks and Spencers and various bodies have been breached. Even local authorities have had their systems and software breached as well. So no matter how big you are, it can affect anyone very easily. So actually just keeping on top of making sure that you're protecting yourself from being given a cyber attack is a key element. And DSPT will demonstrate compliance as well with legal and CQC requirements. So beyond all of just what we're trying to do and trying to guard against attacks, keep information safe, sharing good records, it's also about making sure we're compliant with CQC and their requirements. And beyond all of that, it's often a contractual requirement for councils and NHS. A lot of don't care providers or people going to tender and records, or winning contracts, it will be a requirement to make sure that you are compliant with that in order to win business. So it's something as well to make sure that you have on place or on board, which helps. And the DSPT will be your passport to shared CAD records and other digital innovations with health services, enabling you to be part of a truly joined up sort of network with the interests of the people you support and care for. So I think it's really important, making sure that everyone is looked after, because a lot of the time when we think about social care, we're talking a lot about the physical element of care. We talk about other elements, not being met, medication, moving, handling falls, but we forget now that now technology is a huge part of care now. So you have to also pay attention, and get it wrong can come at a cost. So why is it essential? Well, legal compliance demonstrates adherence to data protection legislation and data security standards, are vital, because if you don't, you can be fined as well. So avoiding fines, if the first thing is going to make sure of making you compliant, it's about avoiding fines. Also builds trust, because it reassures service users, families, and staff that their sensitive information is secure, and enhancing reputation. If you or anyone coming, who your clients or families or anyone doing business with you, hear that your services aren't safe and information is all over the place, they're more likely to not stay with you. So it's important. Accessing NHS systems. So now we know there's always been a big divide between healthcare and social care. And one of the things they said is that social care, their records aren't in good place. And one of the things that they did to make life easier was everyone accessing NHS mail, shared care records, enabling integrated care. And these are one of the things and the sort of pathways being able that to happen. So this is also important of why it's essential with DSPT. As I said earlier, CQC compliance, it means it helps answer CQC questions about data governance, impacting quality ratings. So we talk about well-led. Is your organization well-led? CQC will be looking to things like this. Beyond that, cyber resilience, it helps providers implement security measures against increasing cyber threats. So what are you doing? So we all have things like Windows, we use things on a day-to-day basis, but are we making sure that our systems are safe? What protections have we got in place? And also, it's now a contractual requirement, often a prerequisite for NHS contracts, tenders, and partnership, as I mentioned before. So all of these things make DSPT very essential. A lot of you may have it and maybe think, oh, here we go again, but it's really essential. And as I mentioned before, in not complying and doing things the right way means that you want to avoid being fined, and the fines can be quite hefty. So as I mentioned before, consequences not having it, fines, regulatory issues, CQC inspections, obviously regarding well-led, loss of service, because you can lose service because the ability or winning business, and what it looks like, reputational damage as well, loss of public and partner trust, as I mentioned before, Marks and Spencers and various other bodies that have happened. If you heard that a council or any sort of body has had an issue with their data, it's the last place you want to go to. So, and one of the worst things, which is anything, and I think all of you will be able to relate to this, on the day-to-day basis, we are using software. Even on this call now, we know that it's virtual. If your service goes down and all your records are kept somewhere in a cloud or so forth, and that is and someone interferes with that, then you won't be able to access that. The accurate records, keeping things in place, sending information out, all these things are your day-to-day basics. So it just gets make sure that access the consequence of getting it wrong, and there's also legal action, potential breaches of GDPR and other laws as well. We know records are the bane now of all that we do. And it's not just the records, but the records are essential for things like handovers, access to doctors, GPs' notes, people's health. Everything is there interactive with it. So I always say now to people, it runs through the veins of every organization. So being compliant is just a prerequisite. It's essential. And in essence, DSPT isn't just a formality, it's a core requirement for safe, legal, and effective digital operation in modern social care with serious repercussions for non-compliance. I want you to just sit for a minute and really think about it, because when you came into this business, you probably didn't think much about this, but when you leave here, make sure that you're compliant in no shape or form. We'll give you some sort of reasons of how to do that. CQC themselves have said, and their chief digital and data officer said, CQC will increasingly expect a good provider to comply with the data security and protection toolkit or equivalent as a minimum. This also applies where you use a combination of digital and paper records and systems. So software you use on the day-to-day basis just to do your records, your care planning tools or day-to-day software, from everything else that interacts. They all work through an ecosystem, and you have to be compliant across the board. It's not just to think of just one, but every service you have. So whoever you get on board, always make sure you ask them what sort of safety and security do they have, and what would they advise you to have as well, because that makes life a lot easier for yourself. And when you can demonstrate this and show CQC that, they are very happy. And then, as they said, they look at these when they're coming to inspect you as well. Um, I saw this, and the reason why I put this picture in was quite interesting. Everyone always thinks that, oh, it's not going to happen to me, or it's something small, but I think it's now happening now when we talk about scams happening within, not just in society now, not just in the care sector. Um, Simple things such as ordering tools, items. I shared this over the Christmas period before people were just ordering many things. A man ordered a 32 drill set from an organization, and he received nothing more than a printed photo. So there's lots of scams, lots of viruses, lots of asking you to click on links and so forth. So it's not just about being cyber secure, it's also about being cyber aware as well. So actually understanding the threats, the issues. It's good if you can share this information, especially as dom care providers, share with your clients so and families so they're aware of what's happening. There's lots of things and scams happening on a daily basis. You cannot eliminate them all. So actually having systems in place to help stop that is really important. So it comes down to common sense, but it's also important that you also aware of sort of threats and things that are happening on a day-to-day basis, which is really good as well in regards to that. So, where do we start? The toolkit journey itself. So, for those who haven't or are not aware of it, it's about registering first and foremost. It's completing there. There's questions, and once you've done that, you publish your standards, which are met or exceeded, and this is then reviewed every year. And then there's various mandatory questions that you have to go through, and it's also approaching the standards, and you only have to do this once, but it's something that you should maintain throughout the year. People, and I would say some providers just will just rush for the deadline because there is a deadline every year that they try and meet, but actually having good practice throughout the year should be really something that you really should be doing anyway, and interacting with the likes of Lcas are here to help you, and will give you links, connections, and what you need to do to that. We'll even have time of what to do and share and showcase various practices that are really good as well. And as I say, it makes it funny it's 100% for free. We're supporting you. It doesn't cost you a thing. So the most important thing is that we will give, and Peter obviously give us our details in the chat. But we arrange an appointment, what you need to do. As we said, we have a whole list of order providers throughout of South London, and we will be over the next month or so be interacting with you just to see where you are. We'll be in touch, and then we'll be showcasing what you can do. I think it's about 80% of care providers in residential care were compliant. And I think about 60 to 70% were compliant within domiciliary care. So it's maintaining that, but also then upping for those providers who weren't in that. So there's still sort of a little gap, but it's about maintaining as a whole. So making sure that as well, there's webinars to sort of look at as well. There's one that's as well that's available that's coming up next week. It's Cyber in Care, the Deep and Dark and Hidden Dangers. It's about cyber threats evolving as we know things are happening. It's also jargon free because many people are very are not sure, but also about the dark web and how it's now beginning to target people, what you'll gain as well, and things like that. So there's various webinars that we'll be showcasing as well. It's not just for yourself to obviously upskill yourself, but also getting your staff on to, and those people who are working in and around you who will be able to do that. And I'll share that link later in the group, or Peter will share it as well. We'll share it on the WhatsApp group as well and online as well. So these are some of the things that to look at as well. So easy thing for everyone to start by just registering with the DSPT, and this is done via the website as well. You get an account and you're able to access it, so it should be straightforward. Also enables you to have an NHS mail as well, which is important as well when dealing with the sector. And every organization must be registered with the ICO, and it's not registered, it's something that if you do as a priority, and if not, it can be fine if you're not registered. So these are sort of things that you would probably need to do. Um, Throughout the process, as I mentioned before, there are various questions that you have to ask and answer. And as you can see here, the questions around staffing roles, policies and procedures, your data security, IT systems and services. And before there are mandatory questions and there's questions that sit after that. And they would expect you to go through all the questions in itself and various groups. And once you go through them, you're more or less there. But we also make sure as well that you can demonstrate and have other things in place. And they're now for those who've been doing it previously before and probably say they're veterans at this. There's two additional questions at 25, 26. Do you have a digital asset register detailing your organizational's hardware and software, which is kept up to date? So these things will obviously be asking you about that, and have all the administrators of your organization's IT systems signed an agreement to hold them accountable to higher standards. So there's a few extra questions there that you may not have gone over. If you showcase things like this, I think it's really good. CQC, you're on top of this. They're really happy. So it's also not just for your organization to keep you safe, but also as well to make sure that regulators or anyone else coming to knock on your door, you can showcase what you're doing, which is important. So some of the things that we would expect to have in place these days are privacy notices. Does your organization have a privacy notice? So organizations should have one or more to cover all types of people that they hold data for. That's clients and staff. Key things to check. How visible is it? So it's not just, oh, I've got this somewhere and no one knows about it. Where is it and how is it shared? So actually making people be aware of this. When was it last reviewed and updated? When did you last review it? And does it cover the things like the national data opt out as well? Are you giving people options and things like that? Is this on your website? Is it available for people as well? Um, there's also template privacy notices that we can give you and provide you with. So all these things are provided, as I mentioned, for free. It's what you need, and we can help you give you a whole raft of this. And there's more detailed compliance and advice around compliance for national data opt out for as well. Also, as well, for your policies for data protection, data cybersecurity, does the organization have up-to-date policies for data protection and data cybersecurity? Is something that you may probably not thought about, but it's not just about an up-to-date. Have you read it? Have you looked over it? And it should cover your data protection, your data quality, your record keeping, data security, network security. So all these things are important. And and if you do, which is something we'll be asking you about yourself and your policy. So these are simple enough things as well. And once you've done all of that, you will publish and share your DSPT assessments. Care providers must review and update and republish their toolkit assessments at least once every year. Otherwise, it goes out of date and it's invalid. So it will really help you. As I said, you have the completed 43 mandatory questions that you can republish and show proof of this as well. So it's important that you do this over the next course of the next many months. We'll be interacting with you to make sure that you are compliant and you've done what you've needed to do, which is important. And just remember some things that you can do yourselves is having things such as your own organization spot checks. Does your organization monitor your own compliance with data protection policies and regularly review the effectiveness of data handling and security controls? So have your own spot checks. We always knew when we would do fire drills, and that was something which was straightforward, but actually having your own audit is important. There's an example of an audit checklist that you can download as well, which is important. So things that you can do is, do you regularly check audits? Do you have an audit checklist for this? Do you have a log of these and actions that have been taken as well? So it's not just saying you're doing your own spot checks. What actions are you taking, and what to do to check staff are following your policy and procedures? I think there's a lot more now. One of the things that I would say that people may not people not be aware of is now a lot of people are using things such as ChatGPT. Are you asking your staff, are you using things such as ChatGPT or any other sort of different AI generative tools to um, do your day-to-day care work? Or and accessing, because what they found and CQC have looked at is that people are putting people's information into things like a chat. For example, I'll use Chat GPT, and that is not secure because it goes out. If anyone knows about AI, I'm sure a lot of you do. What AI does, it draws from the information it receives. So if it has information about Peter, I'm sorry about this, Peter, to put you into it, it will then say Peter's records will go somewhere and I can have access to this information. So actually making sure that you are not sharing names, details when you're using some of these general AI sort of tools, because they will pull that information. And so names, records, addresses, all these sorts of things will be shared. So what are you doing in regards to that? It's not just about yourself, it's the staff. Are you on top of them to make sure they're being compliant as well? Because you don't want to, what you don't know, you cannot answer. So when that's found out, how would you know? So it's about asking the questions ahead of time. It's important in regards to that. So what can we do, I say, to look forward in apart from the spot checks? It's really making sure you're up to date with things such as cyber essentials, which is important to help you. Though those sorts of things we would advise. Also as well, who's in charge, who dealing with your anything to do with your digital sort of care and IT and so forth. Do you outsource it? If you outsource it, are you having conversations with the individuals in there? Is there a lead person in your organization who should have there, like a digital champion, a person that's on top of it? I would always say try and highlight by putting someone in place to deal with that, because I think it's hugely important. With all the large companies that I deal with, there is an IT sort of department, or there is a CT, a data compliance officer, or someone like that. Who do you have there? Bring that within your organization, however small it is. It's a role that's wonderful. And one of the things that I'm passionate about is bringing younger people into the sector. A lot of them may not jump and come into sort of social care because of the care element or the day-to-day mandatory sort of caring sides that there is. But when it comes to the IT side of things, you can bring them in. They can help you in regards to your business as well. And it's a role that they can do. And as you can see now, it's almost a full-time role in what's happening in regards to that. So please, 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 I will stop there. It's quite a bit of information to take on board, and to try and utilize that. We'll be in touch, or be in touch with us, and we'll try and share as many things like good practice where we can. Um, and I will leave it open for any questions that needs to be shared, and onwards we go. Thank you.
Brilliant. Thank you, Dudley. There is one point I would just add, and I may have missed it because I've had a couple of deliveries actually for next door. Um, Make sure your business insurance covers cyber security. And if your business is hacked and you lose your business, you need to be insured against business cessation. But having looked at a number of insurance policies, you need to read the small print because some of them will charge you for cybersecurity, but they don't actually pay out unless you can prove where it came from, which is going to be really difficult. So again, get advice from your insurance broker, but you do need to cover that. And I see Ali has got her hand up.
First of all, I am so pleased you guys have got this particular contract. To my mind, digital is very much on all of our agendas at the moment. I know the department is being very, very keen as well as CQC, and it's great that the last people who haven't had the opportunity to digitalise and to use those resources are going to be able to pick up. And I would say one of the biggest things that over the time that I've worked in the field that people have had a gap in their cybersecurity is mobile phones. And I think it's so important that when we think about the cybersecurity that you're laying down, that first of all, you ensure that you've got a process there. But if people are using their private mobile phones, Dudley, I think you'll agree that it falls into that same ambiguous area of putting things through ChatGPT, which we would obviously say, I wouldn't use that. I would always use a co-pilot or something that's encrypted. But I think that the mobile phones are an area that we often forget.
No, I think you're so right. I think, we talk about WhatsApp messages and so forth. I think a lot of care workers will be on their day-to-day and share some information, records, and even people who use devices which are from the company. People have left them on the buses and areas like that. And so even if you lose your phone, what's happening with your information and the data is, are your devices secure so other people can't get into it? So thank you for that, Ali. I think we almost forget that the phone is now like a computer, and
Yeah,
many of you use it for your care work. And
completely.
especially those who are using your own devices, actually, that is probably a concern because your provider or the owner of us as managers can't necessarily go into someone else's phone, but you are hoping those people who are using it on their phone are using it in the best way possible. So I think it's something, as we said, having in your sort of checks and spot checks about people whether they're using devices you provide or devices that they have on their own, or if it's not compromising the data of your service as well. So I think it's hugely important. I would say, and I don't know what the sort of like digital care is going to look like, even in a year's time, the way things are going. But on a day-to-day basis, there seems to be more um, reliance on digital systems and software, and is literally an app for everything
Mm.
that's possible. Probably in the next 5 years, you wouldn't even expect me and Ali or Peter to be here, and we'll have some form of AI sort of tool or something talking here. So
Oh no, no, no. We can't lose ourselves in this, Dudley. Let's not lose individuality.
I'm talking about on this side, not on the care, on
No,
this
I
element.
completely agree. I think that, I came from a meeting this weekend and the digitalization agenda is moving so quick that it's going to be very difficult for providers to keep up with it, but also to keep the people they're providing services for engaged with how their records are being kept with the London Care Record and
Yeah,
also the Universal Care Records. We've got to ensure that our business and the people who are providing those services are really supported in cutting edge activities and given the confidence. And as I say, I'm really pleased you guys are able to push it over the line. Having been involved with the digitalization for about 8 years now, it's lovely to see that so many people, particularly in dom care, and I'm sure a number of our providers here today are dom care, and
yeah.
we forget how important it is for them to have that support, don't we?
Yeah, I think as well as normalizing the language, because a lot of people would say, well, I don't know how to do with technology, or or we're
Mm,
not sure where they're concerned, and or even if you hire out to a third party, I think it's also essential for yourselves just to also have just an overview understanding of what's happening with your information and with your data. You don't want to be asked a question and say, well, I don't know. Speak to this consultant. If that consultant is dealing with various different organizations and you're not sure what they're doing and they're not compliant, then you will then be in trouble because you've relied on them. So I think it's really upskilling your own selves, and even if it means taking a little time just to go over things. I know time is always never easy for us as providers as well, or managers, but I think it's important. And I think the other thing as well, Ali, is really it's not just something that's held for the manager or even
No.
the individual who you designated. It's for everyone using the service. And I
Mhm.
think that's the other thing as well. It's, we talk and we may laugh and joke, but at the end of it, it's going to be the day-to-day, everyday side of things for social care now. And I know there's probably a
Well,
few
yeah.
that are using paper records, but as Ali said, if you're now going to interact with the NHS, GPs, pharmacists,
Mm.
everything's about sharing information and records and data.
Yeah, and we're so often the advocates for the people that we provide services for that in many ways we've got to give them that confidence that digitalization isn't disempowering them, but actually helps bring things together.
Indeed. Peter, you've got your hand up. And then after Peter, I guess if there's anyone who wants to answer or ask any questions, particularly in regards to that, or we're not sure or anything like that, please do ask. But Peter, I will leave you to ask the question, should we say?
Okay, just to quickly, we're still getting people who are using things like Windows 10, and there's no security support for that. And it has been pointed out by at least one local authority that they expect people to have at least Windows 11. There is a fix. If you need to know more about the fix, let me know, and I can put you on to consultants that can sort it out reasonably priced for you. But if not, then you're sorting out some software. We do have a speaker coming to a further event to talk about universal care records, which is fairly well known, but there's quite a lot of gaps. And I'm not entirely sure what's happening with the funding over London social care records or social care records in general. I think they've largely been ceased.
Okay. I mean, they still do exist, so it's still going to happen.
Oh
Uh,
yeah, the funding I'm
yeah,
talking about.
finance.
I think the funding to
Yeah.
do. Have we got
So,
any more questions, or shall we move on to our next topic? But we will be coming back to DSPT big time.
yeah. One last point I want to make, Peter, if no one has any questions, I think one of the things that I think is catching a lot of people out, and I would know this, is a lot of people are going from one system or software to another software and transferring of data and information and records. So make sure you try and have a file or record, whether you're doing it by some file or folder where you're able to keep your information and make sure that's safe and secure. I know people used to use drives and so forth now, but now there are digital clouds and records. So also make sure that your passwords and all these sorts of things that we think are sort of secure. It's the bane of our lives, passwords now, isn't it? But just this on a daily basis are small things that I would sort of suggest as well. So other than that, thank you very much for that. Um, if there's no questions, or you can use the chat because we've got to move on due to time, please use the chat box. And Peter, I think you're going to introduce our next speaker if she hasn't come in already.
Ali is here.
Hi, hi. Well, I mean, it ties into this really because personally, I think some of the digitalization is the key to everything. I do have just some very quick prompting slides, but to be honest with you, I'd rather talk, and I'll read from the slides and send them to you, Peter, if that's all right. Because I think it's really important that we appreciate that digitalization is going to impact everything. And one of the things that we're working quite a lot at Skills for Care for is around the fair pay agreement. And that's going to become much more important as we move into the new financial year. Things have changed dramatically. And I know the work that Peter and Dudley have done in putting out the information around the changes to your business and the financing of your business and staff funding has been really key to you being able to build these workforce plans. But as we go forward, we're going to be supporting an awful lot in regards to the Fair Pay Agreement. And again, I'll reiterate what I'm sure Peter has said before, is there is a public consultation and it's closing in the next 2 days. So if you haven't had the opportunity to go to the public consultation, I will put a little note into the chat in a moment just to help you out with some of those bits. But please get involved in the Fair Pay Agreement because it's so important that we support our workers to feel valued and they're paid a salary they can live on. Part of what we're doing at the moment is working quite closely with the local authorities, and we've been helping out an awful lot in the learning and the social care development funding. Funding for training is such a challenge to us all. And the system has changed over the last couple of years. Previously, Skills for Care were able to drive that system a lot. We're not in the position to necessarily do that anymore because the government is giving the money out. But we are using our adult social data set to ensure that the data is kept and allows you to claim for the money that you need for your training. The big thing is that as of the 27th of October, we have been able to include the Oliver McGowan into the LDSS guidance documents. And that means that if you have staff who are going through that Oliver McGowan training and you have an account with the RSWDS, then you're able to claim back the money that you spend bringing those staff into line with the regulations. We've also got the level 2 care certificate. And that's got a digital component to it, but I would say that, and I hope you would agree, Dudley and Peter, that any induction should also have a digital component to it. We don't have it necessarily embedded quite as strongly as we could have within the care certificate, but you as an individual organisation, I'm sure, will be trying to ensure that any new members of staff are familiar with the policies and processes you have. So as well as looking at the care certificate as a level 2 opportunity and certificate that you can claim funding back for, up to £1,500 for that, you're also in a situation where I would say update and reflect on your digital position. We've got a lot of digital resources to help you with that, and the Digital Skills Framework self-assessment tool ties very nicely in with the work that Dudley and Peter have been talking about. And I would strongly advise you take a little look at those tools, working out how that fits within your environment. But as Dudley said, don't keep it to the higher levels. All your staff team are going to be involved with digital. They're involved with digital every day. They're going to have beautiful little nuggets of skills and abilities that they may well want to come forward in their working environments. So by keeping it as a regular activity within your day-to-day work and talking about it all the time, you can use some of our free bite-sized digital e-learning tools to help with that, but also keep it fresh within your organisation and constantly talk about how can digitalisation help us do a better job. It's not there to cut down what you're doing, it's there to enhance what you're doing. So think carefully about how your teams are actually using those skills and how they can help you as you move forward. Part of that is also understanding how the pathways are going for various people within our industry. We really think it's important as we're looking at fair pay to be able to identify the skills and the resources that people at certain levels within businesses have. So one of the things I would say to you is that we have some great stuff around helping you design your career pathways for staff. Dudley's right, we've got to look to the next generation. We can't ignore the fact that we've got people coming into this industry who are going to look for different directions from the teams that we're working with now. So being able to show people the journey that they can take, mapping their journey of development and skills development can help your team really create a cohesive structure of development and professionalism. Tying into the care workforce pathway also gives you the opportunity to map your work against what the government is recognising as the roles that they're funding to. This all helps us with the fair pay, and it helps us ensure that the staff that we have really do have the skills that we need for tomorrow. And the day after, I hope, as well. So some of the other more interesting things that are happening that we've got at the moment, we've got some really interesting tools that are out there at the moment in regards to dementia. Please do go look onto our website in regards to the dementia side of things. There are some great resources that are making a big difference to people's lives and helping people really embed that personalisation into the agenda for people who are suffering from dementia. As I mentioned before, we've got some great funding available now under the LDSS system for Oliver McGowan training. If you haven't had any of the opportunities to look at that at the moment, please contact me and I can talk you through how we're doing things. Some of you may be nominated individuals and some of you may be CEOs, which makes this conversation that we've had at the start of today even more important about how you bring digitalisation in. But we want to support our NIs and our CEOs, so we have the opportunity to bring people together in meetings and have a discussion as to how the role of those particular individuals impact the work and the movement of a business. So again, I'll be sending this out with Peter. I'll probably put the link in the chat as well. But do think about it. If you're an NI or a CEO, you're not alone. Come and join us. Talk to us about some of the challenges you have. Simple things like, are you running Windows 10 or do we need to help you work out how to readdress some of those issues? These are things that as leaders of organisations, you have a real opportunity to impact. And thinking about impact, we've got two really good summits coming up. We've got one on the 28th of January, which particularly looks at the southeast of England. But for London, at the International Student House on the 4th of February, we have a summit coming up that will be a really good opportunity for us to learn from one another at a very changing time. We have the opportunity to also look at placements with nurses and have the opportunity to see how nurses and students can be placed. And that's a big thing at the moment. I know I've spoken to Dudley on this a number of times of how we support people to ensure that we really do get those opportunities of work experience for students and placements. And of course, we've got problems with preceptorship and ensuring we can get those nurses into the front line that we need from the NHS. So we're doing quite a lot of work around that. And again, we have a meeting coming up in January that will help us come together as a business organisation and actually talk about how we move forward. So we've got quite a few things coming up that would be really interesting to you. I would highlight to you also that we've got an awareness of the CQC assessment seminars. That's coming in with a slight reduction on our costs. We've managed to convince people that summer sales are not something that should be limited to eBay and to Amazon. So we've got a few reductions in costs of items coming up, and that includes the CQC assessment standing area and also the outstanding care seminar. But I'm going to put this link in now into the chat. And if it's all right with you, Peter, I will send it over to you as well. And it's got some of those details. But digitalisation is coming. We've got to come together, work together and learn from each other and to be able to break down some of those barriers. So care associations, Skills for Care, all those different organisations, we're all here to make it a better day tomorrow, I hope. Thank you, gentlemen, for letting me have the time.
Thank you for so much for that, Ali. I think it's important, and there's so many topics that you've touched upon that I probably want to speak lots on, but because just like your website is very huge and social care is a lot to cover, definitely things like dementia is really important because we understand the effect it has not just on social care but society as well. And
Yeah.
definitely in meeting with lots of families, even I have a local neighbor who's going through it and said to me she didn't know where to turn and she was really upset and
Mm.
distraught. But just relief, respite, what to do, even these simple things, not just within social care, people outside social care are not aware of this. This is our day to day. So society as well, actually
Mhm.
giving people options of what to do, what happens when a family member has dementia and what next. So even that.
Empowerment in these situations makes such a difference to how we're able to support. And it's not just about people that we are employed by, it's going to affect all of us in one way or another. So
Definitely.
being able to be inclusive and informed is so important.
And here's a quick cheat code for anyone who wants to gain more business. Day centers and actually in hospitals, actually sharing what you do is really helpful because lots of people want to know. They don't know what to do. So actually signposting them in these places is really helpful. Just even if you do something within the community, because we know community care is really essential going forward. People really want to relate to someone that they probably can, who's local or someone they can know and speak to face and in confidence. So actually, as businesses, it's something that people can do, and even care residential homes and have things like open days for those locally to come and see and what to do and maybe ask questions as well, because I think it's a key element of having that sort of like personal sort of relationship with everyone. So thanks for that. Going back to things, as you said before, Oliver McGowan sort of training, I think there has always been an issue with it because we know that it's a prerequisite for a lot of people in that sort of space. but actually where to go to. So actually providing some funding towards that is important, and actually trying to just find places where there's things around the summit. CQC, we know, is a day-to-day basis with things that are going on, and just information sharing is important. I think one of the biggest things, and the reason why I do like things like the Skills for Care, outside of it being a massive juggernaut at times, one of the things that we're time poor, lots of providers are actually, they have lots of templates which people can actually go to or use to help them with their auditing and other things like that. So at least when that helps, and tying in with what we talked about, digital, making sure your DSPT toolkits and stuff like that, all these sorts of things are a key element there. So I would think it's something that's important, as well as other things that are there. So I'm sure Ali will try and signpost you where you can. And outside of that, I think who doesn't like funding for training and where you can as well, which is always essential. On that note, I'll be quiet, and probably it'll be good if anyone in the out there who wants to ask maybe Ali a question or anything that we can sort of support you with, it'll be a good time to ask, because I know we're probably going to get, me and Peter get lots of calls afterwards saying, and we say, well, why didn't you just ask this at the time? So feel free, we're all friends here, and then I think it's part and parcel of what we want to try and do as a community. So anyone wants to ask a question, if they don't want to ask in person, you can ask on in the chat. It should be fine.
And I've put my email address in there as well. But I would say, yes, the website is huge and we are updating it. We're putting plans together to review it. I think there's many of us that are concerned that we lose some of our historical data. So again, as you said before, when transferring over to a new system, archiving and still having access to that archive is so important. We don't want to lose anything that's vital to our development. So I've put my email address in there. If any of you have any queries about any of this, you can contact me and we can have a little face-to-face online and just guide you through any of the tools and resources that might be useful. Is it compulsory? The specific Oliver McGowan type of training isn't compulsory, but any training that you have must be to a standard that is equivalent. I would recommend the Oliver McGowan training at the moment because an awful lot of people will be trying to match it against the requirements. But what we really love about Oliver McGowan is that user-led experience that takes it through. So it is, if you're providing services to people, then you need to consider how you're supporting people from the neurodiverse community and ensure that you have put records in place that show why you have chosen the training. And also, if it's not standard Oliver McGowan certificated training, as to how it compares to the stuff that the government actually wants. CQC will be requiring this. And do bear in mind, people with neurodiversity aren't new on the scene, they've just not been diagnosed. So awareness of how people's anxieties, concerns and well-being when engaging with other professionals is a key part of our staff's development.
No, thanks. I so agree. I think now, with not just from a business point of view, lots of providers are asking me what else can they do to move into sort of different areas. And if you are going to go into certain areas, obviously we know there is a big growth in regard to neurodiversity as well. So it's something that's probably more commonplace. So just having an extra strand and arm to your business, it's a good to have, but also as well, essentially, as you said, with now working in dealing with those with who are neurodiverse, it's important to make sure you have this training in place and it's compulsory, as Ali said, with CQC registered sort of services as well. So I think that's essential in regards to that. Just the other thing as well, on just another matter separate to this, is as well nurses as well, because people think that nurses are just NHS based, but there are a lot of nurses in social care who feel a bit out of sync. And it's important to also recognize that there's there's cross barriers across, but actually there is support specifically for social care sort of nurses, and Peter and I as well, also supporting that as well. So, and it's also a helpful pathway as well for people who want to go further up into different sectors as an alternative. They may have ambitions to become a nurse in some shape or form, and it also helps in that sense. I think we've got another question here, Ali. I'm not sure. Is the person training?
Yeah, I'm just about to put a whole load of follow-up information for you there, Catherine. Rather than trying to explain it in depth, I'm going to give you a link to the information. Then you can reference that in your own records. Make sure that when you put in your CPD and your information yourself, that you record that you've asked this question and that information has come back. All of these data pieces show great forms of development for you as staff, and CQC like to see a record of how you've grown your information. So as a manager or a deliverer of care, I always used to keep a list of the questions I asked. And those questions were available then where I had the answers to as well. But when CQC came in, they were really pleased to see that I was actually recording and monitoring how I was learning. So have a little think about how you record the conversations that we're having. And if you give me 2 minutes, I will make sure that I've got the link into the chat for you from our website that will answer all of the questions that you're asking.
Thanks, Ali. I've got the thing you sent over to me that the chat will only take certain size documents. That's too big to go into the chat.
I figured as much,
I'll
yes.
circulate it.
Thank you.
Any other questions for Ali, or we'll get John to do a quick update on how to access LDSS funding.
Okay, well, you have Ali's information in the chat. Ali's part of Skills for Care. She's a regular with us anyway. So so any other things, when you sort of support training, share with us, or you can go directly to Ali or Skills for Care. Will be in the right direction. Thank you so much, Ali, for that.
You know me, I'll do anything if it makes the services better.
Indeed,
Thanks,
indeed.
guys. And as always, thank you so much for letting me come along. And anything that people need, please take my email address. I've just put in there a note. It says search, but if you click on it, it will take you to all the information you need about Oliver McGowan. Okay?
Thanks, Ali.
Thanks for that, Ali. John, I think it's your time. I think nothing better to near the end than to give out funding. I think that's what people probably would love.
Yeah, bit of money. Let me just, I'm hoping everyone can see my slides.
Yep.
Yep. Well, thanks, Ali, as well, because I know Skills for Care really do support and promote the LDSS. I think one of the big problems we've got, though, is the Department of Health who run it they're a bit shy in coming forward about how good it is and what's available. And it is a really good funding scheme. It's a direct kind of progression from the old WDF that I suspect a lot of people are familiar with. It's just a shame that more people aren't using it. So what is the LDSS? It's a direct Department of Health and Social Care funding for employers to train their staff. It has now fully replaced the WDF. There was a legacy fund that kind of finished, I think it was last April, but that's now all gone. It funds similar qualifications in a very similar way to some extent. So it funds a certain proportion of RQF qualifications. They're the ones that are nationally accredited by awarding bodies such as Highfield, like the one that we mainly use. It also funds it also funds Skills for Care accredited management courses like the Lead to Succeed and the Well Led. There is funding now available for the Oliver McGowan training and various other bits and pieces. I don't know if Ali has more information, but we know that there's there's probably more than 12 million available in the fund nationally for the year. There is a limit for how much each employer can claim, but it is something around 1.2 million. So I don't think anyone's going to have a major problem with that. It's valid for learners starting courses from the 1st of April last year, and technically the claim period finishes on the 31st of March this year. Although, I mean, I think we are wholly expecting the funding to carry on. I've not heard any nasty whispers that it's not going to. Well, it funds, one of the good things about it is that if you are putting learners on a diploma course, for example, or the new level 2 adult social care certificate, which are longer courses, you can actually claim 60% of the fees up front. The bad news is that you will need to demonstrate that you have paid your learning provider the funding to be able to claim that upfront. So that is a major change from the WDF, where everything was kind of claimed at the end, but it's also a major change in that you've got to demonstrate that you've paid the learning provider if you want to claim it upfront. The remaining 40% can be claimed at the end with the certificate as evidence. For each of these claims, there is a 3-month period. So you can only claim 60% within 3 months of starting the course or paying for the course, whichever is the nearest number, or within 3 months of somebody completing the course, splitting it 60-40. Just like the Workforce Development Fund, there are no restrictions on nationality. Eligible employers just need to be legally employed and have a UK national insurance number. So again, you don't have to worry if you have legitimate overseas workers in your workforce. You can use this funding to train them just like anybody else. To become eligible, there are a few steps to take, one of which is, just like the Workforce Development Fund, you still have to have an active and eligible account on the ASC workforce dataset. You have to complete an onboarding form, and the link is in there, and all of these slides will be forwarded after the show, as it were. For that one, it's a relatively straightforward process. You fill in the form, the Department of Health will be in touch with you, and they will take you through the other stages to set up your account to be able to claim. You can submit claims once a learner has completed a course or split between 60 and 40%, as I said before. And just remember that you will need to evidence paying the learning provider to be able to claim. In terms of the ASC, I think everyone would agree, well, I'm hoping everyone would agree, it's really important to carry on making sure that the Department of Health has good, up-to-date knowledge about the size and scale of the social care workforce. So much of the funding that we receive depends upon this. It's how we kind of justify the fact that we are a huge workforce of 1.5 million people. We do need support, we do need funding, and this is what people do. So please do sign up with that and get kind of involved if you've not already done so. It's essential to claiming funding for your training anyway. There's a full list of eligible courses on that link to the government LDSS website. It does change, well, I don't know about frequently, but it certainly seems to change every couple of months. So it is worth checking and rechecking before you book learners onto any training, just in case there's been any updates on that. With us, I mean, I think I should point out that other learning providers are available, but with us, we have a fairly straightforward process. If you want to enroll learners on a course, contact myself or Joanna, or, well, she's going off traveling in about a month's time, so we'll have a new Joanna whose contacts I'll put up later. Tell us who you want to be copied in terms of your learners' progress and bookings. Check that you understand the commitments and guidelines you and your learners need to follow, which will be things like when you're in training to keep your camera on. I know we don't in this one, but when we're in training, we need to, because we need to make sure that people are there and paying attention and getting involved. And more importantly, we need to make sure that somebody isn't actually out with a service user and kind of inadvertently breaching any confidentiality with that. We will send out all the enrollment links to your learners, copy your nominated manager in, and also, you know, I know I keep saying it, but do remember, if you want to claim, you do need to pay your learning provider. And I know most people were really good, but there were some people who would wait until they actually got the claim before paying the learning provider, and that kind of backwards way round doesn't work with LDSS. And all of your learners will need to have access to a computer or laptop or a tablet. They can do it on mobile phones, but it's not recommended. It's just fiddling about a bit too much on small screens is not great. Every week we train new care workers, and if you're an employer in, well, anywhere in the country, actually, we have people from down in Somerset who are regularly sending people to us, but you can send as many or as few onto the training as you would like. We do a combined course, so we do the non-accredited, the normal care certificate knowledge, and remember that that means that you will still have to do your competency assessment in-house as you always have done. And we combine that with the level 2 certificate in the principles of medication handling and administration. It's a really, really good course. It knocks spots off the normal kind of half-day medication course that you would be putting staff on, and equips them to much, much better kind of engage with the people they look after and make sure that they're not making mistakes with medication. We use the funding that is attracted through the LDSS for that level 2 certificate to subsidize the training that we do for the care certificate. So for that one, it's basically we only invoice you for the LDSS claim back amount for the level 2 certificate in medication, although you also get your learner doing the level 2, the care certificate knowledge as well. Sessions start every Thursday. They start from 9:30 till around about 12:30, and they are expected to be free for the afternoon to complete online homework through Highfield's Vault system, which is an online portfolio. It can also be taken as a standalone course just on the Thursday and Friday with homework. And we've put thousands of people through that course over the last few years. Mainly in London and the Southeast, but because it's online, it doesn't really matter where you're based. For managers and coordinators, we run the Skills for Care endorsed, well-led and Lead to Succeed courses, and we run the various single session manager modules. They, again, are all done via Zoom. And again, we only invoice you for the actual claim amount that you can make from the LDSS. So effectively, those management courses and your new staff training are free, essentially, which is always a good thing. I should point out, you can see the Quality Assured Care Learning logo there. We're one of probably, I think, only about 20 people in the country who have been accredited as quality assured for some of the courses that we deliver, and they include the management courses we do and the diploma courses we do, and the level 2 medication as well. For specialist knowledge, we run regular cohorts through the level 2 certificate in the Introduction to Autistic Spectrum Conditions. It's run over 3 weeks, with each week having a 2-hour Zoom session and approximately 8 hours homework in total. It is a very, very good course, but it's not for the faint-hearted. Although it's a level 2, I think everyone who delivers it agrees that it's probably at a level 3 standard. So I would suggest that it's good for coordinators and managers, and particularly able staff members. We also run the level 2 award in the awareness of dementia. And again, both of these courses are funded through the LDSS, and we only charge the funding amount that the LDSS pays to you. So again, they're free. For diplomas, we run the full gambit of level 2 and level 5. Level 3 and level 5. The level 2 diploma is under review at the moment, and we're not expecting that to come back for at least a year or so. So do be very wary of anyone who's trying to offer a level 2 diploma linked apprenticeship or training, as whilst those courses still exist, there's no funding available for them through the LDSS. With the level 3 and the level 5 diploma, we do charge an employer contribution. And if you want to find out more about that, just please get in touch. We normally expect a level 5 learner to get through in 12 to 18 months. Some are quicker, some are longer. Level 5 learners, because they're largely managers, we understand that it is tricky to get this work done. Level 5 is a large qualification. It is equivalent to doing nearly a degree at university level. There is a lot of written work. We do a lot of tutor-led assessment on that as well. So we mainly because we want to try and avoid the use of AI. So if you are writing a dissertation as part of that course, we will have a video Zoom session where you will be talking to that dissertation as well. So please be prepared that that is a big course. The level 3, we normally get people through within about 8 to 12 months. And bear in mind, these are not through apprenticeship funding. So there is no requirement to do any functional skills or the actual apprenticeship or the actual time limits that apply to that. So it is a different way and a quicker and speedier way of going about things. We also, for those that are interested, we don't do many of them, but we do the level 3 award in training and education, which is the core assessor award. There's other stuff you need to do as well, but it's the first path on being able to be an assessor yourself. And if you have staff who've already done this in-house, we can talk about them working with the diploma and the level 2 social care certificate as well. There are various important links. All of these, I've checked them, they're live and up to date, and they will be on the slides as they go out. And of course, if you've got any other questions, just get in touch with us. And if you, I'm going to put our contact details in chat, but if you get lost with that, Peter will always be able to forward stuff to us. But that was just a brief outline. I know we haven't got much time, but thank you very much for that.
Thank you so much, John. I think, as you mentioned, it's not just about the free training, but the array and vast things that people can have, not just for your staff, but also for managers. And one of the things I think is hugely important, this training is available for also your international staff as well, which people always think there isn't any sort of support for them, which is really helpful. Please do get in touch with John, because it's not just about the training, it's about how you get through the on the LDSS. That can be some of the sort of complex things that it's not that complex, but you probably might need a handhold, someone to hold you through it.
Yeah, I mean, to be fair, their support service, I know when people have gone to it, is generally pretty helpful. But I know occasionally people have gone to it, and I don't know whether they've got somebody who's just started that day, and it's been slightly less than helpful. But keep plugging away. Yeah.
Yeah, and one thing I will let everyone know is if we do not use the funding, it's lessened. And I think people always seem to forget that. And if you think, oh, utilize it, please. It's one thing we don't do enough in social care, is trying to do that. So it's important in regards to that. So thank you very much for that. I know our time is almost up and we're running very, there's not much time. So I'm just going to share something very quickly before we go for it from this point of Lcas again. So hopefully you see my screen. So Lcas have been helping and supporting international recruits across London. We've been working with North Central London. We're doing work with Southeast London and potentially also with Southwest London as well. We'll be running a 3-hour interactive workshop, inclusive support and transformational work. This is for actually international workers within your organizations. This is not for displaced workers, but actually for those who are here already. It's a 3-hour session. It's been well received. You'll be in groups, and it's in person as well. So please utilize. You can get in touch with me and Peter. So anyone in Southeast London will be running them. There'll be dates that we will release. If you're interested, so you can send your staff on there, maybe 3 or 4 at a time. It's important. It covers domiciliary care and residential care, so that's also well and good. And also North Central London, anyone who's in North Central London, and we'll potentially be doing something in Croydon as well, coming up. So please do get in touch. It's a fantastic session. but also really plays a big role of what's happening at the moment, and not just on the day-to-day experiences that your international workforce are having, but also what to do next, their career pathway, and just with all the changes that are happening as well, taking place potentially. And to say that, we want to make sure that everyone, have you had your say by responding to the government consultation on the indefinite leave to remain? It's anonymous. The deadline is the 12th of February. I'll put the link in the chat. It's something that you can share through as many people as possible can do it. Your managers can do it, your care workers can do it, anyone can do it. We want as much as possible to respond to what the government is doing. We understand this change will affect all those who've come to this country already, who said that if they stay here for 5 years, they're able to remain, but changing that to a new system of between 10 to 15, almost 20 years on what you do. So actually it's being really making sure they are aware. So I will stop sharing, put the link in the chat, so that people are aware in regards to what they can do. So it's filling out the form. Please do take your time to do that. It's important, because we know that almost 19 to 20% of the workforce are made up from overseas workers. So, and if they do leave or stop coming in, social care will be, until we can get our sort of homegrown workforce in place, are really going to be a big gap in the market. So please do bear that in mind. Peter, I will now pass it on to you.
Okay, thanks, Dudley. I'm just popping in the chat the date of the next meeting in February and the Zoom link for that, which obviously we'll repeat sort of endlessly between now and then. A few quick points. Whilst we've been in the meeting, I've had a health and safety update, and also what looks like a fairly complicated document about SSP, the good old statutory sick pay. And if I can make sense of it afterwards, I will circulate that as well as part of the notes to this. If you are dealing with local authorities on a joint contact basis with ICBs, or you're dealing directly with an ICB, they are changing the ICBs and some of the contacts will change. And if people leave the ICBs, they're not going to be replaced. So if you've got a contact, make sure you keep the contact, or if they leave, find out who the new one is, because they won't be directly replaced, or unlikely to be directly replaced. And some of the joint posts will also disappear. So the email addresses or contact details that you have will no longer function. And they may be important to you. We were going to try and squeeze in a bit around planning for neighbourhood health, which is something that's moving at pace. But we haven't got time. There's no point just doing a couple of sentences on it. So we will bring that one back to the fore. If something is happening in your area and you'd like to let us know, we'd be very pleased. It is coming through, and again, it will impact on CQC, it will impact on cyber, it will impact on joint working and getting paid, etc., etc. So hopefully today has been useful for you. It has been recorded. Dudley will do his magic on that, and we will get it to you fairly shortly. All the slides, etc., will also pop up on the website at the same time. If you've got any issues, do talk to us. Please do use LDSS funding, and keep Skills for Care busy. And
Oh, just one more point, Peter, before you round off. We know that there's various, when we work with a national, the Care Association Alliance, and looking at uplifts and fees, and it would be good if anyone can let us know, especially as there's 33 different boroughs in London, of any sort of fee uplifts, whatever you're getting or will be receiving. We try and share this into a sort of a national sort of like database. And I think there's reports on obviously the cost of care and cost of living and how that's going to work out for you. The other part of it is that, especially with domiciliary care, we know that people having to pay the national wages as well and stuff like that. How are you going to meet that, especially if your service? So if you're going to go for a contract and tender, people are not looking at the cost of it does, how much it will cost for just employing each member of staff. And is that going to be plausible for your business and business sustainability? So please do bear that in mind in regards and going forward, whatever you're doing. It's going to be a long year ahead, but really it's about trying to speak to us, share information. We're here to help you as a care association. There's so much information, but also, as Peter said today and others said, there's funding, support and help along the way. Do look out for it. And if you don't ask, you don't get.
I would just add to that the proposed fee increases that the local authorities are going to receive from central government are not going to be ring fenced, so they don't have to be used in social care. How that is going to be applied, we don't know, because no one has actually said yet. But we are seeing local authorities engage consultants to come in and get them, or to show them how they can spend less on social care, which means lowering fees or raising standards, which is not going to be good for your businesses. So you need to work together. As small providers, you can't object one by one. You need to collaborate. So do let us know if you've got any issues, and we'll see what we can do. There are national talks going on to try and sort of ameliorate the problems. And there are a few people who are listening. Some of them aren't, but some of them are. So let's see what we can do to help you out and make this a successful year. Again, thank you very much for attending. We look forward to seeing you in February. If there's anything we can do, please let us know, and we will be in contact with you, certainly around DSPT in the various areas of London. We will be in contact with you over the next period. Many thanks, and you get the rest of your day back now. Thanks. Bye.
Thank you.
Bye.